Good afternoon, and welcome to today's Industry Scientific Seminar. My name is Phil Gehrman, and I'm the current president of the Sleep Research Society Foundation. And it's really my pleasure to introduce our friends at Nanit, who are going to be presenting in today's Industry Scientific Seminar on autovideosomnography in pediatric sleep research, how computer vision and technology and big data can unlock new research opportunities. If you could move on to the next slide. And the information today is not specifically an endorsement by the Sleep Research Society Foundation or the Sleep Research Society. And the next slide. And so it's my pleasure now to introduce Dr. Maristella Lucchini, who's going to get us started off, and she will introduce the other members of their team. Thank you.
Hello, welcome everyone. Pardon me for my voice, but I'm Maristella Lucchini and I'm a senior clinical researcher here at Nanit. Previously working at Nanit, I was at Columbia for 8 years. I have a background in biomedical engineering, and then I've got my postdoctoral training and in sleep in the perinatal period. I'm really thrilled to be joined here today by Dr. Michal Khan and Tor Ivory. And so, Dr. Michal Khan, would you like to introduce yourself?
Sure, thanks, Maristella. I am Dr. Michal Khan. I'm a clinical psychologist and a sleep researcher at Tel Aviv University. I did my PhD with Professor Avi Sadeh and my postdoc with Michael Gradisar. And about 3 years ago, I returned to Tel Aviv and set up my lab. And most of my research focuses on pediatric sleep and the links between sleep and emotions and psychopathology such as insomnia and nightmares. And a lot of it has to do with all of this and infant sleep, which I'll tell you about soon.
Thank you, Michal. Tor?
Yeah, nice to be here. I'm Tor. I'm co-founder and CTO of Nanit. Been in the tech industry for more than 20 years. Did my BA and MA on computer science, and started a company around 11 years ago.
Cool. So we'll hear more about the experiences of both of you later in the presentation, but thank you very much for joining also, because for you as later in the evening, so we really appreciate your time. So moving on, today's agenda, we will start with a brief overview of recent trends on emerging technologies in sleep research with a specific focus on early childhood. And in that context, we'll explore the role of Nanit and what Nanit can do, starting with the origin story of the product in a conversation with Tor. And then we'll move on to a discussion with Michal to hear her perspective on how using Nanit has opened up new possibilities in her research. So without further ado, let's get started. So when we think about new technologies in sleep research, we're really all aware about the massive growth this market has had in the past 20 years. And this growth has been fueled by several converging factors. So we have technological advancements on one side, increased public awareness of the importance of health and well-being, and also the rise of the relevance of big data in research. And so with all these new devices, including wearable, nearables, new apps, we really have seen incredible advantages in the sleep research community. For example, the ease of use, the minimal invasiveness, the fact that they're really apt for longitudinal and naturalistic data collection. But they also have raised a set of very important questions, such as what could be standard procedures for using them, what happens to the algorithms and the metrics once the software is updated, how can researchers access raw data, and these are just some of the issues that as a sleep research community we've started to address. Many companies have entered the space of adult sleep research, and here on this list I've just listed a few. So if you can move on to the next slide. In response, researchers have conducted really rigorous studies to validate devices and establish standardized frameworks for testing performance. So not just validating the devices that are already on the market, but also thinking about how can we make sure that we have a constant framework for validation, since there's always new market offerings coming for this particular field. So interestingly, most of these devices are focused on adult, and some are designed for school-age children and teens, but very few for early sleep in childhood and infancy. And that's precisely where the Nanit system thrives. So if you can move on to the next slide. I would like to tell you a little bit more about the Nanit system and what it is and what it can get you.
I think another slide, Michal.
So Nanit is a smart baby monitor that uses computer vision and machine learning to track baby sleep pattern, breathing rate, and growth, and provides insights to parents. So while the product was initially developed as a consumer tool, science has always been one of the company pillars. And so that foundation has really allowed to develop algorithms that offer researchers access to reliable and objective sleep metrics and characterization of caregiver-child interaction, access to stored video and audio, and also environmental data such as temperature and humidity, and a very interesting feature, also breathing rate tracking. So we will explore a little bit how all these features can be integrated into research projects when we're going to talk later with Dr. Khan. But first, I'd like to take a step back and share the incredible story behind this product, which I really think will allow us to understand its core values and pillars and how this can be so relevant for the research community. So starting the conversation with you, Tor, you have been part of Nanit since the very beginning when it was still an ambitious idea. And I wanted to ask you if you could start by sharing how this idea of Nanit first came about and what was your original vision?
Yeah, sure. Michal, first, I think the slides are not synced with Maristella, so move
Well, you
until the
talked more.
slide
I'll try to log
another
back.
one, because I think Maristella can see the screen. Okay, this one.
All
That's
right.
it. We've got here. Okay. So the funny thing about the initial phases of the Nanit history, it didn't really start with babies. It started in the clean room of a semiconductors company, Applied Materials, where Asaf, the other co-founder of Nanit, and myself worked together and built computer vision algorithms to analyze the semiconductors yielding factory. And so we created algorithms that were helping in the diagnostics and controlling of the semiconductors. And a few years later, we both became parents. And we had a crazy thought: what if we could utilize our knowledge in computer vision to try to do what we did for the clean room, but for babies? As you or some of you may know, like, the early days of parenthood are really filled with a lot of ambiguity. You don't really know what you are doing. It's a lot of trial and error. But we believe that with like the right approach, we could bring some clarity, confidence, and care into that world. And our idea was really inspired by, if you can move to the next slide, it was really inspired by, as you see, like on the left side, the huge machines that we were using in Applied Materials to kind of look into with microscopes into the silicon wafers. We borrowed that idea by placing a camera above the crib. And we thought that if we can have a fixed camera and put it in like many cribs around the world, we could create an easier problem for us, where like the baby and the crib are almost like are very similar between different locations, and we can apply the same method to analyze even the smallest of movements. And then with that crazy idea, we met late Avi Sadeh, which was already a world-renowned expert on infant sleep. And he, together with Tom Andrews, were really like pioneers of using manual videosomnography and actigraphy to identify when babies are asleep or awake. And we, like, our initial approach was really to just use those same methods, but like apply them with camera. So this was like our original idea.
That's super interesting, and I'm glad you already cited, that your early collaboration with Professor Sade. But I was wondering if you could expand a bit on how, from like the early beginning, the research and the scientific background really has shaped the foundation of Nanit.
Yeah, so Nanit was really born from inception as a science-anchored company. The company was born as part of the Jacobs Institute, the Runway program. Jacobs Institute is a collaboration between Cornell Tech and Israel Institute of Technology. And that program was really about bringing together PhD and postdoctorate students and commercialization of science.
Mm-hmm.
And we really brought that idea of like using sleep science to really take the parenting to the next decade. And so the collaboration with Avi Sadeh, which was, by the way, Michal's supervisor in the PhD, we really applied like a dual approach that was combined between our commercial path of really like, how can we help parents, and instead of them kind of staring into the video monitor, just like we can alert them when there is something that is really important to know. And on the other hand, we were always kind of using science to validate our technology, but also as a tool that helps other researchers, answer their own scientific questions using our method. Because I think one of the interesting things that Avi was very excited of was the ability to use Nanit in any house, like without putting anything on the baby. It just sits there and can monitor everything. And the second aspect of it is the fact that it can track the parent interventions and not just the baby itself.
Yeah, that's definitely something that sets apart the technology of Nanit from like traditional tools that are currently being used in pediatric sleep research. And so one other thing that I wanted to ask you, and I think, Michal, you can probably move to the next slide. I'm not sure what you guys are seeing, but where we see the breathing wear technology, because I think that because Nanit is really based on this computer vision technology, sure, this can allow to monitor sleep and provide these objective metrics, but that is just the beginning. And I think that one of the most interesting part of Nanit is also that there's a lot of other insights that can be provided and sort of integrated together with the component of sleep health. And so, Tor, do you want us walk us through a little bit? What are some of the insights that you have, that you and the Nanit team has sort of integrated in the system so far?
Yeah, for sure. So as you said, like I think the fact that we can use the camera and we can use vision allows us to do many things that others can't. And over the years, we added more and more functionalities that really are speaking to the needs of our parents or our users, starting with really like watching for the torso movements. Like the camera can lock on that pattern that you can see on the slide, those rectangles, and using very small subpixel movements, we match those movements into breathing frequencies, and we can tell what is the breathing rate of the baby. And I think we're the only company that is actually using this, what we call breathing wear technology, because you can basically either use a pajama or a band or a sleep sack that has that pattern, and we are tracking breathing using that. But it's not the only thing we can do. over the last few years, we also added the ability to really track the head and body positions. And by using that, we can identify things like fine and gross motor skills. We can track developmental milestones. We can tell parents when babies are leaning more into one, like the left or the right side, and many things that we can and want to do in the future with those technologies. But it's not all, like it's also about fun, because uh, since like the camera is there and sits there, like we capture all those fun moments, and many parents really like to share it with their bigger families. Some cute moments of brothers playing together, sometimes pet comes into the crib, and really fun stuff. So yeah, vision is really like allows us to do many unique things.
Yeah, I think that's super exciting, and you've already sort of touched upon some things that are just at the beginning, like at the cusp, with all this movement tracking, starting to monitor growth, but really in the future, potentially doing more and more work on motor development. And so I just wanted, to close this, if you wanted to share a bit, what are some of the things that get you excited in terms of what opportunities are out there for the next years, and I hope that hearing the things that we have done and that we're about to do, this will also get our fellow researchers excited about how can they be part of this future development of new things and new features.
Yeah. So and sorry for repeating again, but it's coming back again to the original vision that Avi Sadeh was part of. The fact that we now have this camera in such a large install base over so many cribs around the world. We tracked by now like billions of hours of sleep and movements and milestones. Really allows us to kind of fulfill our original destiny, because, as I said in the beginning, diagnostics and control for babies is really about, like, since we have all this vast knowledge base, we can start thinking about like what is normal, what is not normal, to provide guidance based on the patterns that we're seeing, based on the age, based on the room temperature, other stuff, and start doing things like predictive analytics, where we're matching things that are coming from different sensors. Just like like we see that we can identify that the baby is coughing more and is not sleeping well. We can advise the parent, maybe you can check fever or something, maybe something is not great. So really, like, it's about going to the next level with providing more information for parents so they can make the best decisions for their families.
Yeah, I think this is very interesting because it goes back to what I was saying in the beginning, that really the surge of all this new technology is paired on the relevance of big data, as you're mentioning. Like, now that we have access to the data, we can really start to understand these new insights that can be given. And I think, as you were saying, with the goal always to provide more confidence to the parents, make this information more meaningful and helpful. So thank you very much, Tor, for all you have shared. And I think that, looking back at the origin of Nanit, it really highlights how this company's core pillars are incredibly relevant for parents, but also for researchers as well. So Michal, if you can move to the next slide that shows some of the validation work that we have done. Because Tor spoke about how research and collaboration with academic partners have been central to Nanit since its inception, but the commitment has only deepened as the company has grown. And which is why, Nanit's algorithm, although they were initially developed in collaboration with researchers, we also invested time to make sure that we could gain independent validation by external sleep scientists. And so In this slide, I've listed some of the papers and the findings, but just to summarize, and I hope that, if you're interested, you will have time to take a deeper dive in these papers. But to summarize, the research has shown that Nanit's estimates of objective sleep duration closely aligned with those providers by observers that were, scoring the videos, and also in the epoch by epoch analysis, which has been really the best way that has been recommended by all the articles that we had seen in the beginning in terms of validating new devices. Nanit sensitivity and specificity has matched that of actigraphy, which we all know is a widely used tool in sleep research. So this was very exciting for us as a company to obtain this external validation, really sort of supporting the work that we had done up to that point. So Nanit, Michal, if you can move to the next slide, talking about Nanit Lab. So although research has been a defining part of Nanit's identity from the beginning, it was about 3 years ago that sort of the company formalized this commitment and established a dedicated research division at Nanit, which is called Nanit Lab. And the mission of Nanit Lab is really to serve as a think tank, bringing together scientists, researchers, clinicians from a wide range of fields, certainly starting from sleep research, but also thinking about neurodevelopment, parental mental health, and so much more. And what we've seen through many of our collaborations is that Nanit data has really helped scale researchers and their work and securing more funding. So moving on to the next slide, showing our amazing medical and scientific advisory board. We're currently supported by 4 clinicians and researchers in the board, and Nanit Lab is led by Dr. Natalie Barnett, who is our VP of Clinical Research. So if you can move to the next slide, Michal. Over the past few years, we have grown significantly. And so, as you can see from all these logos, we now have partners truly around the world, which is incredibly exciting. And in the next slide, our core research pillars include, as I mentioned before, sleep health and infant and child development, but also parental wellness. And this is truly because we believe in a holistic approach where the focus is supporting the well-being of the entire family and not just of the child. And so today, our collaborations have resulted in around 15 peer-reviewed papers and over 50 conference abstracts. And we have so many more to come. But if you want, you can scan the QR code on the slide, which will give you access to an updated list of these publications so that you can see a little bit of the flavor of what we have been able to do up to this point. So if you can move it to the next slide. So far, I have told you a bit about how Nanit came to be and how we have partnered with other researchers. But now let's talk about you and what you can expect as a researcher if you're interested in using Nanit for your own research. So let me walk you through some of the way that most of our collaborators use Nanit device. And that's because it's really the beginning of the possibility. In these last 3 years, I've been at Nanit, ways that the Nanit was used in research has been constantly evolving. So I hope this is just a starting point. But yeah, so researchers mostly, after receiving IRB approval and always participating consent, what they can do is use Nanit to collect objective sleep metrics. So for example, as an alternative to actigraphy, they can recruit from our own user base, so people that already use Nanit as a consumer product, and then integrate the objective sleep metrics with custom questionnaires that could, for example, assess information on demographic or physical and mental health so that they could pair the information from these surveys to that of objective sleep metrics. But, the objective sleep metrics are just one of the things that Nanit device can give. In addition, we also store video and audio recordings, and I think, going back to what Tor was saying before, this has proved to be really interesting in terms of providing us information on infant motor development. And, a lot of researchers have benefit from this type of information, environmental temperature and humidity, and so much more. And while some researchers decide to integrate the Nanit in their own study cohort, there are also many that, as I mentioned before, also leverage the unique opportunity to recruit from our own existing user base. So we can move to the next slide. In the next slide, you should see here some of the numbers of the metrics that we are collecting every day. And again, because there's so many users, these numbers continuously go up. And so we have around 500,000 users worldwide, and researcher can gain access to this large and diverse data set, which allows to explore questions that would have been truly hard to address with traditional tools, and also allows studies to move faster and reduce participant burden. And so, but rather than sort of keep giving you sort of abstract examples, I really would love to pass words to Dr. Khan, who can share some concrete examples of how using Nanit has benefited and expanded the opportunities of research. So, Dr. Khan, please take the lead.
Thank you, Marcella. I think I'll just to make sure, I'll stop sharing for 1 second, just to make sure I have the, have I stopped sharing?
Yes.
Yes, all right. And I will now share what I think is the updated PowerPoint. So can you see my screen again?
Yes.
Awesome. All right. So really excited to be here today and share a few of our studies that we've done together with the incredible team at Nanit. I'd like to start by sharing my financial relationship with Nanit. So from 2019 to 2022, I received a research grant, and then I later served as a consultant for the company. And this financial relationship ended 3 years ago when I took up the PI position at Tel Aviv University, but my emotional and scientific relationship with Nanit is going strong. And first, because we're really talking about an amazing group of people. So you see me with Tor here and with Natalie Barnett. And Marcella, I realized I don't have a picture with you because we still haven't met in person, which is crazy.
We've worked for 3 years together, yeah, but never in the same space.
We have to figure out a conference to make that right soon. But also because of the huge advantages of autovideosomnography in infant sleep research. So as mentioned, I did my PhD in Professor Avisadeh's lab, and I've always believed in the value of objective measures of infant sleep, just to kind of go beyond parent reports, which are also important, but to get that comprehensive picture, you really need to see what happens objectively as well. And autovideosomnography not only allows for objective, non-intrusive assessment in the infant's natural environment, we don't have to bring them into the lab or do anything like that, or even put anything on their bodies, right? Because the camera is mounted above the crib. But it allows for collection of these data over multiple nights. Because with actigraphy, if we get a week, we're happy. But here we're not talking in days or weeks, we're talking in months. And that just provides so much more robust measures, enables us to follow developmental trajectories within baby, track milestones, and see how external events like the COVID-19 pandemic or other things that happen in the real world impact infant sleep. So that's really huge. And we can also collect data at scale. So I'll show you in a moment. We're, again, not talking about samples of 50 babies or 100 babies. We're talking much bigger. Pardon me. And that really opens up big data opportunities in infant sleep research. And also, we're not only getting infant sleep data, but also objective insights into parent behaviors, like how often parents visit the crib at night, And for someone with my research interests, that's also very, very important. So all of this means that we can now tackle research questions that used to be very costly or even impossible to study. And we can now look at them. And I'd like to share only 3 quick examples of the kinds of questions that we've been able to explore using this approach. And I'll start with the first one. So taking us back a few years, one of the first questions that we asked together was, did infants sleep differently during COVID-19? So with all the madness that's been going on since the start of the decade, the pandemic craziness is beginning to fade, but sorry, I'll just mute. All right. So again, that's better. We still remember the pandemic craziness. It's starting to fade, but one of the things that 2020 was different than previous years was that, you know, it had amazing memes coming out. But also another difference was would the pandemic impact infant sleep? So when the pandemic hit, actually, a lot of people in the sleep research field raised concerns about possible negative impact of home confinement and the change in routines on children's sleep. But at the same time, we also noted some possible benefits. So routines are more flexible, there were fewer extracurricular activities, fewer commutes, and potentially more time for sleep. And using autovideosomnography, you see here Professor Michael Gradisar from Flinders University in Australia. He was my postdoc advisor. And together we set out to longitudinally compare infant sleep patterns before and during the pandemic with the help of the Nanit team. And we looked at a 2020 infant cohort and a matched 2019 cohort. And the beauty of this approach was that we had objective data that was collected in 2019 in real time. So we didn't need to rely on retrospective parent reports like most COVID studies had to do. And so we included 610 infants that were monitored nightly between January and May of each year. All right, so that was about 4 months of data per baby. And we matched the 2019 and 2020 cohorts on age, gender, and city of residence. And we had in total over 71,000 nights of data for this study. And just to give you a gist of the results, these are the smooth nightly averages. So you see here sleep duration, wakefulness in the crib before sleep onset. So sort of a metric similar to SOL. We have sleep onset, sleep offset, morning out of the crib time, and the number of awakenings. And the red lines and ribbons represent 2020 infants, and blue represent 2019. And as you can see, from January to about early March, sleep patterns were nearly identical. And this was corroborated by mixed modeling. So I'm not showing you the inferential analysis here, just the descriptives, but you can see that there was virtually no change. They're identical. But look at what happens around mid-March. You know, it sounds familiar, right? When the lockdowns began, things start to shift. And the two ribbons kind of start growing apart. And when we analyzed this again with LMMs, we saw that in 2020, indeed, infants slept longer at night. They woke up later and were taken out of the crib later. And this was true for 3 of these metrics. And by the way, you can also see the daylight savings transition in early March in these graphs. So especially for the sleep timing metrics, you see this rise when there was the move. It's spring forward, right? In March, that's what it's called. So our study suggested that despite all of the negative impact, of course, that the COVID pandemic had on our lives, there was a silver lining in terms of infant sleep. And this finding actually dovetailed with other studies in older children and adults showing that there was longer sleep durations. And at least something good came out of this crazy time. So this was the publication published in JCPP in 2021, and you're welcome to read and look into the details if you'd like. The second study I'd like to share centers on a question that I often get asked as a clinician in the clinic by parents of infants. They've heard about sleep training and controlled crying and cry it out and all of these methods. And they ask me, does it work? And also, are these interventions safe? Because we know that in social media and not only in social media, also some voices in academia have criticized these interventions. And it's a constant kind of question that I think we need to gather as much evidence as we can to understand the impacts of these interventions. So just to give you really a minute of background, infant sleep is a major concern, as of course all of you know, for a lot of parents, and many of them are looking to do something about it. And there are three common forms of behavioral interventions that are typically used. The first is unmodified extinction, often called cry it out. It involves placing the infant in the crib and then leaving the room without returning until morning wake-up time, unless the infant is hurt or sick. Then modified extinction, also known as controlled crying or the Ferber method. This uses the same basic structure, but parents return at scheduled intervals. So they would kind of check out of the room and then check in after 2 or 3 or 5 minutes to reassure the infant, then leave again and come back at the same scheduled interval. And third, parental presence, sometimes called camping out, involves the parents staying near the crib. So there are no checking in and out. The parent is present, but the reassurance is only offered intermittently. So it's the parent would maybe feign sleep and then intervene only every 2, 3, 5 minutes. And randomized clinical trials have consistently demonstrated the effectiveness of these brief interventions in improving infant sleep without evidence for harm. We know this from reviews and meta-analyses and from individual studies like the one that some of the ones that I've referenced here. However, RCTs only provide a partial view of how BSI's behavioral sleep interventions can impact infants and parents, because they typically only include infants with really severe sleep problems, so they have to fit the inclusion-exclusion criteria. And also, these interventions take place within the structured clinical research setting, in the setting of the clinical trial. But in reality, parents implement these interventions all the time outside of research and clinical settings. They just do it on their own without the professional guidance. And we don't really know what happens then, how effective and how safe are they when they're just implemented in the wild. So that's what we set out to test. And how did we do this? Again, partnered with Nanit. And here we recruited 2,090 parents of US infants aged 3 to 18 months, all of whom were using Nanit camera monitors. Most participating parents were mothers, and most came from households with moderate to high income and education levels, so high SES samples. The design was cross-sectional, and parents, of course, consented to share their infant sleep metrics from the previous 14 days. So we had 14 nights of data. And in this case, we also asked parents to complete an online survey, which they didn't do in the first study that I showed you. Here, parents reported on, first of all, their experiences with implementing BSIs. They also completed the PISCI to assess their own sleep quality, the Epworth for daytime sleepiness, the EPDS for their depression levels, the parent-infant bonding questionnaires, and also demographics such as infant age and gender, room sharing, breastfeeding, household income, so that we could adjust for all of these in analyses. And we had 2 research questions. First of all, are these interventions associated with objectively measured infant sleep? So have parents who implemented these interventions, do they have infants that sleep for longer or shorter periods of time? Are there any associations there? And the second question was, is implementation of these interventions associated with any negative parent outcomes, such as depression or poorer sleep? And this was, again, really important to me, because I always talk to parents about, they're concerned that there may be negative effects if they implement any sleep training. And any evidence that we have to show, I think, is really, really powerful and useful in a clinical kind of setting. So what did we find? First, BSI implementation was associated with better infant sleep. So infants whose parents had used unmodified or modified extinction, because in the survey, they reported what they had used with their infant. And here in the green and blue are the unmodified and modified extinction, so cry it out and controlled crying. Those infants of parents who'd implemented these interventions slept on average 18.9 minutes more per night than infants whose parents had not used any BSI, which is shown here in gray. And they also slept 25.5 minutes more than infants whose parents used parental presence, shown in yellow, which was an interesting kind of surprising finding, that parental presence was kind of negatively, or, you know, the association here, what we expected it to be, that parents who had implemented that would sleep kind of on the same level of those who used unmodified or modified extinction, but actually there was a pretty big difference. Imagine 25 minutes each night. That accumulates pretty quickly. And we saw similar patterns from night wakings and parental crib visits, with the extinction-based methods associated with more consolidated nighttime sleep than the other groups. And also important is that there were no significant differences across groups in parental well-being or the parent and infant relationships. So parents who had implemented BSIs were not more tired, nor more sad or disconnected or sleepy than the parents of infants that hadn't implemented BSI, which I think, again, that really is a very useful finding for me that I often speak to parents about. So we have here some further evidence for the potential of BSIs to facilitate longer and more consolidated nighttime sleep, and also for the safety of these interventions. And of course, there were limitations to the study. It's a cross-sectional study, and we discussed these limitations in the full paper at length. You can see it here, and again, would be great if you'd like to take a deeper look. Okay, so finally, the third example, I'd like to tell you about a more recent study. This is a bit of a myth buster. Does teething actually disrupt infant sleep? So most parents and healthcare providers believe that it does, right? And if you ask me, of course, you know, the infants, the babies teething, they're going to sleep really poorly tonight. And this idea has also been supported by previous studies. So there have been studies showing a link between teething and disrupted sleep. However, most of these studies have been retrospective, based only on parent reports. And of course, those are prone to recall bias, especially when we're talking about nighttime events. So we wanted to test this with objective sleep data. So we recruited 849 US and Canadian parents of infants aged 3 to 18 months, again, all of whom reported a tooth eruption in the past 4 weeks. So it had to be pretty recent. The tooth eruption had to be in the previous month, and they had to remember exactly the date of eruption. We collected autovideosomnography data over a 3-week period leading up to the tooth eruption, because we knew the date of the eruption. And then we also took the week following the eruption night. So we had that month of videosomnography data with 3 weeks before and 1 week after the eruption. And again, we asked parents to complete an online survey about their infant's tooth eruption, including the timing and the location and symptoms and how they managed the symptoms of this eruption. And so we again had both objective and parent-reported perspective on sleep and in this case, teething. And here's what we found. So although over half of the sample reported that sleep was disturbed during teething, so parents here, and this replicates previous findings, if you ask parents, they tell you, yes, when the infant was teething, they slept much more poorly. But when we looked at the objective data, there were no significant differences in any of the metrics between teething nights and non-teething nights. And you can see here, I hope it's not too small, in these figures, you can see the patterns across the entire monitoring period, so the entire 4 weeks. The red boxes indicate the teething period, 1 day before to 1 day after. So we took, as previous studies did, we took 3 nights just to make sure that there were effects maybe a night before and a night after. And total sleep duration, number of night wakings, and parent visits to the crib all remain stable throughout the assessment periods. You can see the averages in yellow, and there's nothing there in the red boxes that's different than the other nights. So we've got some thoughts about why the parent report and objective data were discrepant. I think it's a really interesting kind of thing to think about, and we discussed this again in the paper, and this was just published a few months ago, again with a fantastic team of collaborators, including Maristella, of course. So there are a few other research questions that we're currently exploring, and certainly many more ahead, I hope. But for today, I hope this gives you a good sense of what's possible when using this kind of data. Of course, as with any measurement tool, there are limitations. You know, the samples could be more of a high SES kind of samples in nature, and the fact that the data capture only sleep that occurs within the crib. But, you know, any metric has its limitation. We can talk about limitations of actigraphy and videosomnography, and of course, parent reports. And I think this approach really opens up exciting opportunities for using this objective, ecological, validated, continuous infant sleep and parent behavior data at a scale that we really haven't seen before, in the thousands of infants. So thank you to Nanit for inviting me to speak today. Thank you to all of my collaborators involved in these studies, and thank you everyone for listening.
Yeah, Michal, I think I couldn't have thought of a better researcher to really highlight the breadth and all the possibilities that can be explored with Nanit because of all the work that we've done in all these years. So thank you for taking the time to go through it. I'm starting, well, since we are at time, almost at time, we have a few minutes for questions. So please feel free to drop your questions in the Q&A. And in the meantime, I think on the slide, you might be able to see some contacts in case you have questions to reach out either to me or Michal. I see one question about the possibility of collecting data on sleep disorder breathing using autovideosomnography. That's an excellent question. I think that definitely we don't currently do that. We don't do that yet, but that's for sure one of the things that we are starting to explore, not just because we have videos, but also leveraging the audio to identify, for example, periods of snoring and combining that with the technology to identify breathing rate. You know, that sort of puts us in an optimal position to identify some, you know, some proxy or at least some screening measures for sleep disorder breathing. So that's definitely something that we have considered. And if that's of your interest, please reach out. We would love to have partners that can collaborate with us. I see another question about infant length and if we can measure that accurately over time. And Tor, correct me if I'm wrong. We do have, do you want to speak to it, Tor? Maybe, I think you.
Yeah, for sure. We developed a unique way to measure babies. We actually have our own kind of sheet that has a specific pattern, and we can use that pattern to really identify like the pixels and translate those into inches, and then we can use that to measure the baby length. So we're using the baby skeleton to measure length using that pattern.
So as of right now, what the measuring of the length can be done only when these sheets are in the crib, because that sort of provides these reference points that are critical to develop the measures. So we do have some information, but it's sort of reliant on the use of the sheets as well. What type of sensors are in the Nanit, and does it include lux level and light information? That's also a great question, and I'll take a stab, but if you want to jump in, feel free. So I think that's a feature that is under development as of right now. In terms of information about the environment, we only provide information on temperature and humidity, but definitely, you know, the information about noise level and light is something that we feel like
we actually have the sensors, so it is something that we plan to add.
We don't store it yet, but it's definitely doable. Let's put it this way. And I think it's something because the actigraphy provides similar information and it can be super helpful for some of the estimates of the sleep researchers is something that was sort of put on our timeline. And then our plans to test and validate Nanit among preschool and school-age children. I think it would be, we have done this in preschool, not as much as we've done, let's say, in the first 2 or 3 years of life. We haven't validated our metrics yet in older kids. I think also as the kids get older, there can be more concerns about privacy and the kids not sort of feeling as comfortable being recorded the whole time. But I think it's something that from a technology perspective could be done. But yeah, we haven't validated our metrics yet for this older population. Other messages of congrats. Thank you. So I'm just checking to make sure that we have addressed all the questions.
Maybe,
yeah.
Maricela, in the meantime, I think you can't see the slides, but did you want to talk for a minute about the call for research proposals?
Yes,
That was.
Yes, thank you so much. That was going to be my next topic. And so if you have it on the slide, that's an opportunity that we have developed in collaboration with SRSF. And so we're not only thankful to SRSF for hosting us today in this webinar, but also for providing us this platform to reach out to more researchers, both through this webinar and through this call for grant applications. So what is included in this grant is the opportunity to collaborate with us. And so, as I've said, to access, of course, always prior to obtaining RB, approval and user consent to the data from our own current users. And so if you, do you have the QR code on the slide, Michal?
Yeah.
Great. So if you guys want to scan the QR code, but you can also see this on the SRSF website, you can find all the information and all the details on what will be included. But again, for any questions, feel free to reach out. We would love to work with you. I know that this is a new technology, a little bit different from what you might be used from your previous research. So we would be happy to work with you to identify some the best way to work together. So I think, I would like to thank everybody for taking the time to join us today and to, learn more about this new technology. I hope that we have provided all the information that you needed to decide it's worth to give it a shot and to join the Nanit research family. I'm always here, just one email away to answer any questions or curiosity about how we can work together. And thank you again, SRSF, for hosting us, Tor, for sharing all the backstory. I think, I've heard it many times, but I feel like every time it adds a little bit of a flavor and color. And, it makes me more enthusiastic being part of this story and how we can take all the seeds that you have planted to really add continuously in terms of, the parenting journey and the research journey. And, I have the pleasure to use Nanit both as the researcher and as the consumer with two of my 3 kids. So I think I've seen all the aspects combined, and it's been an incredible journey. And again, thank you, Michal. I know it was hard to choose which one of your studies were sort of the most representative, but I think you've done a great job. But if you're going to look in the list of all our publications, you'll see many, many more work that Michal has helped us do. So thank you for all your work. And so with this, I would like to thank everybody that joined us. And, hopefully I will hear from all of you soon and we'll work together. And so bye and thank you so much.
Thank you.
Bye.